The next question, the member for Chatham-Kent-Leamington.
Thanks, Speaker. And my question is to the Minister of Health. Many people have succumbed to the pressures of getting vaccinated by their employers or be fired. Many aren't given reasonable accommodation to have rapid antigen testing to save their jobs. They're in danger of losing their homes, providing for their families, and downside results continue to climb. Vaccination should be about freedom of choice. The Premier stated mandatory vaccines in healthcare has been dropped, yet many of the Ontario health teams are telling hospitals in their areas that mandatory vaccine will remain in place. So nothing changes, and people continue to lose their jobs, creating a healthcare crisis. Truthfully, Speaker, no one can tell me what changed from yesterday to today. Yesterday, workers were safe, using proper COVID protocols, providing for their families, going to arenas to watch their kids play hockey, and frequent restaurants. So, Minister, what's changed? We are now a two-tier society, splitting families, putting neighbour against neighbour, and forcing business to turn away patrons. Is that what you and the government really want?
Minister of Health to reply.
Speaker, and thank you to the member for the question. I think the short answer to your question is because we're in a pandemic. We're in a pandemic and we need to save people's lives. That's my responsibility as Minister of Health. That's our responsibility as government. That's why we've had to take these measures. Nobody wants to do any of this, but we have to. We've had to we've had to implement measures in order to save people's lives before the vaccine was available. Now that the vaccine is available, we're asking everyone, especially with this new variant of concern, we still need to know more about it, but it's all the more important for people to be vaccinated. If you haven't made your appointment, I'm urging all people to please go out and be vaccinated now. If you're ready to receive a booster shot, please go and get that. We are going to be looking at changing the age requirements for people to be eligible to receive the booster, and there will be more information available about that later this week.
Response.
And please consider having your children vaccinated as well, ages 5 to 11. That's the way that we prevent this vaccine from spreading and that we can all return to our lives as they used to be.
Supplementary.
Back to the Minister. We know vaccine development, testing and regulation is a painstaking process that takes years of dedication and hard work to complete. COVID-19 products have not gone through the same process and rigor. Long-term safety and efficacy data that is crucial for assessment is not available. What's worse, various injury reporting databases show immediate effects of vax-caused injuries, and deaths has quickly reached unprecedented levels. Public Health Ontario, as of November 14th, reported 537 cases of myocarditis and thousands of adverse events following immunization. And now parents can register their 5 to 11-year-olds to be injected. Healthy children are at a minimal risk of severe outcomes like hospitalizations from COVID-19. Minister, considering the above points, will you provide the legislature with better rationale for the decisions to vaccinate children other than saying these vaccines are safe?
Minister of Health.
Well, these vaccines are safe. I can assure the member of that. They've gone through rigorous testing protocols. We're very fortunate that we have the technology now that we are able to have these vaccines available for adults as well as for children. We know that many parents still have questions about the concerns they have with respect to vaccinating their children aged 5 to 11, and that's why we have information available. We understand that there will be questions, and that's why we have a partnership with the Hospital for Sick Children for parents to call to ask those questions and then to have their children vaccinated. This is extremely important because right now we know that a third of the new cases of COVID are occurring among school-aged children. So it's all the more reason for parents to protect their children, to have them vaccinated, which protects their children, their loved ones, and their community. This is absolutely important, and we urge everyone to please move forward, have your questions answered, and please have your children vaccinated.
Thank you. The next question.